Another important point for the management of patients with myelofibrosis is that we used to say that interferon was not good for these patients because it was really poorly tolerated. And indeed, in the French group, the FIM group, we could collect a large series of more than 60 patients with myelofibrosis who received pegylated interferon for the treatment of their disease, and we could evaluate the long-term outcome of these patients. And we had some good surprises. First is that the drug is efficient and well tolerated, with not so many dropouts in the treatment. But what we showed during this meeting is that the overall survival of these high-risk patients with myelofibrosis was better than expected compared to the reference cohort and according to their risk category, especially in patients with intermediate 2 or high risk according to the DIPSS scoring system. So a better survival than expected. The second point is that this survival was even better when patients received interferon alpha as first-line therapy compared as second or third-line therapy. So probably starting early treatment with interferon in patients with myelofibrosis results in better outcome for these patients. And lastly, we could also observe and test these patients for the presence for their molecular profile by next-gen sequencing, and we found several mutations in most of these patients. The median number of mutations was 1.6 mutations per patient, with JAK2 of course and CALR as being the driver mutations, but also a series of additional mutations, including the so-called high molecular risk mutations, the most famous being A6L1 mutation, for example, that confer worse prognosis for the patients harboring these additional mutations. Interestingly, although we could confirm that presence of additional mutation was a bad prognostic marker for those patients, we didn't find that those high molecular risk mutations conferred a really significantly poorer prognosis compared to any other additional mutation, suggesting that maybe interferon alpha treatment could, let's say, impact on the worst prognosis of these patients, an effect that has not been shown before.